Hi guys, welcome back to Women, Wine and Wisdom. My name is Naomi.
I'm Jimmy.
And today we are going to be talking about all things Botox, injections, fillers, you name it. But before we do that, we are going to be introducing our wine, of our choice of wine for today. And it is a Bastions white bush vine. I'm not lying. It's actually called bush.
Okay, cool. I was going to say.
She was going to be like, hey, you've not even started drinking and you're already... No, it's called Bastions white bush vine. So here we go. Just going to give you a little... So I'm going to pour a little sippity sip for each of us.
Yes, and while you pour for us, I'm going to introduce Dr. Deborah, who's going to say what she does because I can't pronounce the word properly.
So my name is Deborah. I am a medical aesthetician, but I'm also a GP trainee.
Okay.
Amazing.
We're very excited to have you.
Thank you for having me.
There's lots of questions for you. We put it up on Instagram.
Oh, gosh.
So you got a lot of questions. I think, obviously, with social media, the rise in us seeing Botox, fillers, injections, women's wellness,
Thank you.
just in general. Can we just also note that Naomi didn't pass me a glass?
I'm so sorry. Do you know the reach was too much of a reach? So
I get that though. But yeah, so it's going to be an interesting topic. And yeah, I think we're all going to be very excited to dive in.
But before we do that, you know what we've got to do? Jimmy,
I'm
you
just smelling.
started. Before we do that, you know what we've got to do? We've got to cheers.
Cheers, guys.
Cheers to our guests.
Okay, it's actually sweet now.
Yeah.
It's all right. Actually sweet. It's
All
all
right. All right. Okay. I'm going to dive straight in because
Go for it.
first of all though, actually, how are you finding GP training?
To be fair, I'm actually enjoying it.
Okay.
Yeah. So GP training is like, it's broken up into 3 years. So the first year, you're in like the hospital. So for a year, and you have like 3 rotations, which are like 4 months each. And then you go into GP training for the rest. So you'll be in a GP surgery for 2 years.
Okay.
But luckily I had a GP rotation first, and then I went into the hospital, which kind of gave me a taste of what like GP life would be like.
Okay.
Yeah, and I actually really enjoyed it. Even though I was only there for 4 months, I had like regular patients, and it was nice. So like my whole reason for going into it is like the continuation of care.
Okay.
I'm in the hospital at the moment. I can't say that I do like it, but it's a means to an end. Yeah, it's just a means to an end. We'll leave it at that.
I was gonna dive in and ask another question, but I'm gonna skip that. I love questions, so you'll kind of realize. Okay, so how did you kind of get into Botox and fillers? I'm not gonna say the word, guys, because I'm not gonna embarrass myself. But yeah.
So, how do I get into? Well, okay, I do aesthetic or medical aesthetics. The reason why it's medical aesthetics is because I'm a healthcare professional.
Okay.
So there's other people who do aesthetics, and they aren't healthcare professionals, but they're still aestheticians. And we just
That's the word that.
that's the word you're struggling. So how did I get into it? So I do love medicine, but I feel like medicine can be quite rigid, and rightly so, because it's just to protect patients, but there are like a lot of guidelines and a lot of policies, and you have to follow certain things.
Okay.
And I feel like aesthetics is like the creative side to medicine. And I feel like both go hand in hand in like holistic care for like patients or clients in general. So on one side you're treating them medically, and then the other side you're treating their outward appearance. And so yeah, that's why I thought let me go into that.
And would you say their outward appearance is linked to their mental?
For some people, yeah.
Okay.
Some people definitely feel better mentally if they feel good outwardly, physically. And others don't necessarily mind. But that's part of what we do. So during the initial consultation, we discuss how they feel about themselves mentally, how many times they might look at themselves in the mirror on a day-to-day basis. And the reason for doing that is to make sure that you're not over-treating someone. So if someone has some sort of dysmorphia and they come in, no matter how much treatment you give them, it's never going to be enough. And then as a medic, you have to draw the line.
Okay.
I was going to ask that.
I've got
because I
two
was gonna
questions
say,
from that.
like,
Yeah, but go on.
how do you know when somebody is like obsessing about the way they look? And because ultimately somebody could come and just be like, it's just this one cheek. I just need it to be a bit more snatched or whatever it is. And then I don't know, like 2 weeks later they come back and they're like, I need more done to myself to really feel like.
And I reckon that happens.
I feel
a
like
lot,
that does
to be
happen a lot.
honest.
Yeah. So
Yeah.
I think it sometimes it can be hard, but you know in the consultation, and that's why you just have you have a chat with them. So when I have my consultations, I introduce myself and I'll say, okay, so what are we doing today, or what are your main concerns? And sometimes clients come in and they don't actually know what they want. They'll be like, oh, okay, can you have a look at my face? What do you think might help me? Or what do you think will look good? I just want to look a little bit fresher. I don't want to change my face too much. And then there's other people who come in and say, no, I want this, that. And then they could ask for my opinion, and then I can disagree with them. And actually, I'm not sure about that. And the good thing is that we can always decline them. I'm like, okay, actually, I'm not going to do this treatment. And they can go somewhere else. And I think that's the good thing about being a medic, because you still have to have that moral ground.
Duty of care.
Yeah, you do have to have that duty of care. And I feel like sometimes people go to other aestheticians and they can see that they don't need this treatment, but they will do it anyways. And
I thought you had to be regulated now to do, like, I'm not going to say the word esthetician.
Aesthetics.
Aesthetics, there we go.
Yeah.
So I thought you had to be kind of like, you have some form of certification to do it now.
No, so
okay.
So yeah, aesthetics isn't regulated, but they are trying to regulate it now. We're not sure what that looks like, and we're not sure who will be able to continue doing that. But I think they're trying to do that at the end of the year. But at the moment, so with healthcare professionals, any healthcare professional can do it and call themselves a medical aesthetician.
Okay.
And non-medics, anyone who has, I think it's a NVQ in beauty, can do it. The difference is that with Botox, you have to have or you're supposed to have a consultation with a doctor or prescriber, the person who's going to prescribe the Botox. But with filler, you don't need to have
a consultation.
Yeah, you don't necessarily need to have a consultation.
And that brings me to our next question, because we got a question about this. So one of the Instagram questions was, what do I ask in a consultation, or what should I look out for in a consultation when I'm going for Botox? So are there particular questions that they should ask you as a medic?
Yeah. So they're supposed to have an extensive, so you're supposed to have like a questionnaire. Okay. So you should have a medical questionnaire. They should ask you, do you have any allergies? They should ask you what your regular medications are. They should ask you if you have any like health concerns. Yeah. If you've recently had COVID, because sometimes, we've seen in the clinic that sometimes if you've had a recent infection with COVID, or if you've had COVID vaccinations, it could affect the results. So we always ask you to come maybe like a few weeks later. And then we do ask you some mental health questions as well, just to see where your state of mind is at. So those are the basic ones. And then on the day we ask you, okay, what do you want? Like, whereabouts on your face you want to have the Botox, and what your desired effects are.
Okay. I was going to ask because there is this kind of general question of, are you allergic to anything? Like when you go to an esthetician or any or even if you go to the hairdresser and they're like, are you allergic to the hair dye? But I feel like some people don't know what they're allergic to. So how can they find out what it is that they're allergic to?
So do you mean in terms of aesthetics or just in general?
I guess in general, but also specifically to aesthetics. Because
I think with aesthetics it's quite difficult. With Botox, it's unlikely for you to react to it. Like, not many people are allergic to Botox, but some people are. So if you have had Botox in the past, some people can say, oh, I'm actually allergic to this brand. Can I have this instead? So that's why we always ask, because we don't want to assume. And then in general, I think if you feel like you do have allergies and you have runny nose, the best thing to do is go to your GP and try and get an allergy test. It is quite difficult to get an allergy test, but that's the best. I think that's the best route to go. Yeah.
Okay, no, fair.
What
Yeah.
is Botox? What actually is it?
I think we do need to clarify this.
Yeah.
What is Botox and what
Because
is fillers?
what exactly what the difference actually is.
Okay, so what Botox is basically a toxin
Mhm.
that you inject and it relaxes the muscle.
Mhm.
So wherever you inject Botox, that's the area relaxes. So for instance, if you inject it in your head, it will relax the frontalis muscle at the top here. And the reason why people do it is because, say for instance, you're very expressive.
Yeah.
Naturally,
even me, I'm like.
naturally over time, what happens is that you might have static lines that develop over your head, and static lines means that there's lines present without you actually moving your face.
Yeah.
So that's why people get Botox or preventative Botox to prevent those lines
That's
from
a question I've got. No, don't worry.
to prevent those lines from appearing. Whereas filler, so Botox doesn't actually add any volume. It doesn't do anything. It just helps with the appearance of wrinkles.
Okay.
Usually it helps, smooth your face. Sometimes if your wrinkles have too far gone, it will just aid the appearance. It might not get rid of them completely.
Okay.
Whereas what dermal filler is hyaluronic acid essentially, and it's something that's actually found in your skin.
Okay.
It adds volume to wherever you're injecting it. And that's the main two differences. So
Are they bad for you then? Because there's such a stigma around getting them.
Yeah.
Like, are they? Is it because of what you've just described to me? In my mind, I'm thinking, okay, I'm gonna go do Botox
like-
tomorrow. You know what I mean?
Yeah.
But it's like, are they actually bad for you?
I can't. Well, I do it, so
She's gonna be like,
it's
I
hard,
get it.
Okay,
hard to
fair.
say. I think
Yeah.
I do understand why it can be very controversial.
Yeah.
I do understand why it is controversial, and I think it's because there hasn't always been a lot of research about it. And initially, when people started doing it, it was very hush hush. So people were having work done, but no one was really saying what it was, and etc. And no one has really researched the long term effects of what Botox and fillers do. That's why people are not sure. So obviously, if you're not sure of the long term effects, why would you want to inject something into you? But I think people tend to go for Botox first, and the reason is being is because it usually wears off after 3 months. It depends on how quick you or how fast your metabolism is.
Yeah.
So usually 3 months to 3 to 6 months. Some people have a really low, like really slow metabolism. So it lasts a lot longer for them. Whereas dermal filler, people feel like it's a little bit more permanent. And sometimes if you don't like the effects, you have to get it dissolved.
And how do you get them dissolved?
So it's with another
Aesthetician. Is that the right word? Aesthetician?
Jimmy, please.
I'm really trying, guys.
So it's hyaluronidase, and so I'm sure people would have seen it on TikTok. People get in, filler dissolved, and then go to the hospital. And the reason why is because some people can be really allergic to that.
Oh wow!
And if you don't know, then it can obviously send you to the hospital. But the good thing is that we have, in our clinic, we have the things that will help. So to help with any anaphylactic shock or with any allergy response. So we have adrenaline, we have aspirin, we have that all on hand.
I was going to say, what kind of like side effects would you see?
So so it's literally like a reaction that you would have to any allergen. So you would have like swollen face, swollen lips. Sometimes your throat might close up.
Oh my god.
That's
careful,
very
guys.
very like rare.
Yeah.
And that's on the extreme side.
Yeah.
But we do have the things that will help with that. Yeah.
I'm curious to know, do you think that social media has had an effect on the rising use of Botox and fillers?
Yeah. Okay. Definitely. I feel like everyone now is influenced by someone.
Yeah.
And everyone has social media, even if you don't feel like you're on social media that much. To an extent, I think everyone's influenced. And we have to give credit to people like Kylie Jenner and Chloe, Kim. We have to. And I feel like it all stemmed from there. So ever since, it came out that, Kylie was getting lip filler, I think there was a rise in that. And I feel like people are more open about getting it.
Of course, yeah.
Which I think is better. I think there's no need to hide. And I think it's just an enhancement. it's not as if to say, or some people do change the entire contours of the face.
Yeah.
But I think you can pick and choose what route you want to go down, whether you want to be natural or not. Up to you.
I was gonna say, because I think the use of, like, just to add on to that, I think you got the Kardashians, which is one side of things, but I think also you got the filters on social media, which is just.
Can we talk about those filters? Because I obviously spoke about this in a previous episode.
I know, I saw that.
So many people, so many people
If you
replied
haven't
to
watched
this.
it, go watch it, guys.
Oh my God.
Yeah, so like, really interestingly though, guys were like, Jimmy, I completely agree with you. I feel like if you're using filters, the answer is no, that you're not pretty. And women were like, but Jimmy, if you wear makeup every day, for example, are you pretty? And it's a really good question. But I mean, we spoke about this off camera again, because obviously I thought it was hilarious that there were so many responses. Because obviously when I asked it, I was just like, as a question, right? Yeah. But the answer is, my answer is, let me rephrase that. If you feel that you need to filter every picture, then you might actually be pretty, but you don't feel that you're pretty.
Yeah, I agree.
And that's actually the difference. So
but then on top of that, it's kind of like that probably prompts a lot of women to go and get the Botox or go and get the fillers, because a lot of these filters, it will kind of give you a more chiseled look or make your nose look a bit smaller. Like I've heard about the Ryno. Is it the Ryno?
Yeah, non-surgical rhinoplasty.
Hey, skibble. Which is basically like the thinning of the nose, right? Without actually like doing anything too surgical.
So yeah, it's not necessarily thinning of the nose. It's giving the illusion.
Come and see.
It's giving the illusion.
So wait, is this a
non-surgical?
What?
Yeah.
Non-surgical, non-surgical rhinoplasty.
Okay.
So essentially, I think the people who benefit the most are people who have like a little notch in their nose, because you can just flatten it out.
Okay.
And then what people are going for is like the pixie tip, so that it's like it points up, and you can do that with filler. But the only thing with that is that it doesn't last very long, so it does drop. Yeah, after a while.
Okay.
Yeah,
that's interesting. And preventative Botox, is that actually a thing?
Yeah, and no. It just depends. So people get preventative Botox because they feel that they want to start, looking after their wrinkles or wrinkles before they get them. But the actual fact is that you don't know if you're going to get wrinkles or not. So people feel like, oh, I just want to get started now, just in case.
I do get them.
Just in case you do get them, but you don't know if you might get them or not. That's the difference. So obviously you can say preventative, but you might never have had them to begin
in the first place.
Yeah.
One thing I did actually want to ask, and this isn't one that anyone has asked us. This is one that I've just it just came to mind. They always say black don't crack. What is the real? I mean, what's your thoughts on it as an esthetician? Do you feel like it's just
a medical esthetician?
Oh, sorry.
Oh my God, I said the word as well.
Well done. Can we let's give Jimmy a clap, please.
A medical esthetician.
But do you feel like it's true, or do you just feel like it's just one of those things that people just say? Like, do you think there is something about the black skin that makes it not crack?
Do you know what? I think it's just because we've grown up using moisturizer. I'm not gonna lie. I feel like honestly, I feel like it's just because we've grown up using moisturizer, and I feel like it's only now that people from other ethnicities are caring about their skin, wearing SPF and all those things. And to be fair, so for instance, our Caucasian counterparts, they are at a higher risk of getting skin cancer. That's just because of the lack of melanin that's in their skin, or reduced melanin, shall I say, not lack of. And that's just their genetic predisposition. Whereas with us, that's not the case, and we don't absorb light as much as their skin might do. But I think, honestly, it's just our skincare, and we've always grown up using moisturizer and those things, whereas it's only becoming almost like not a trend, but people are more aware that, okay, they need to use SPF, they need to moisturize to have good skin. And I feel like they're white people, Asian people, they can have just as good skin as we do, and they can, age just as well as we do. So I don't necessarily feel like it's black don't crack.
It's more
It's not like we've been
use
born with it.
moisturizer.
That's
SPF
what I
helps.
genuinely feel.
Amazing.
That's a really good point.
That's
because I'm thinking about it now. I'm like,
yeah.
I can see how that would make sense. Okay. let me go back to our questions that we had. So.
What are your thoughts about the wine, by the way? Are you
I
enjoying
actually
it?
like it. Yeah,
It's
yeah.
really, actually, it's
yeah,
really
I
nice.
like sweet drinks, so this is sweet. It's not too sweet, but yeah, I like it. What do you
Good.
think?
I think it's okay. It's giving
Okay.
me
I'm here like
7,
this.
7 out of 10.
7.
7 out of 10.
Okay, well,
I'm liking it.
Why not 3?
Because I feel like it's sweet enough, but not too sweet.
Mm.
And I feel like it's quite crisp, but I'm very terrible. I hold my wine really badly. I hold it like this. So I've warmed it up a
it's
little
warmed
bit.
up, yeah.
But I think like in the summer, I could definitely see myself drinking a wine like this.
It's nice. It's nice.
I enjoyed it. Let me just. No.
I was gonna say.
Let me have another sip though.
What are your thoughts? What's it giving you?
It's given nice.
Yeah,
It's given. I like it. Yeah, it's given salad. It's given summer. It's given enjoyment.
Not salad, girl. Not salad.
Not salad.
It's given salad. It's given enjoyment. I have a question though. Tear trough filler. This was actually asked on Instagram. Would you advise it?
It really depends. It's very, very subjective.
Okay.
And it's based on a person to person basis. And the reason why is because not everyone would be a good candidate for tear trough filler.
Why?
Because you need to look at the integrity of the skin.
Mm-hmm.
You need to look at the puffiness. You need to look at if there's hyperpigmentation. And what I said before is obviously you're injecting hyaluronic acid into that area.
Yeah.
And what hyaluronic acid does is it draws water. So if you already have puffy under eyes, and even if you have just a little bit of hollowness, and we fill that with filler, what will happen is in the mornings you wake up with really puffy eyes.
Oh wow, okay.
Yeah, so I would say that it is really good, and people have really good effects, but there is a fine line. So sometimes if it's underfilled, some people don't see the benefit of getting it, but then if it's overfilled, they feel like they're a bit puffy. So it is really based on an individual basis, and then you just have to go to a good place.
Is it quite scary to like inject by someone's eye? Because I'll be thinking, oh girl,
it's actually not. So how we do it is that we just get a needle, and so for instance,
Just a needle.
So you get a needle and you introduce it like under your eye. It's very far from where we're actually injecting. So we introduce it here, and then we get a cannula, which is like a blunt edge, so it's not sharp at all.
Oh, fine.
So people don't feel it at all.
Really?
Yeah, they don't
And
feel it. It's
scar
like
or anything.
no.
Oh,
It's like one of the easiest ones. Yeah, it's not painful at all. The most painful filler is lips.
Oh,
Really?
Then
And that
you
seems
look
to
at
be
my
so
lips, you can-
common.
I'm like, I was just like,
But that's the most common one though,
Yeah.
no?
Yeah, it's very common, but it's very painful. Yeah.
okay, so if you've got a lip filler, guys, anything else is not going to be.
If you've
It's
got
not
like a
gonna
lip
be as
filler,
bad,
can you
yeah.
comment out of 10 what the pain what your pain threshold is?
Yeah.
Because now I'm curious.
Yeah. Like some clients, they have to take breaks.
No, stop it.
Oh wow.
No, I'm not joking. It's the most like there's so many nerve ending there, of course, and it's a rich blood supply.
Yeah, actually,
So
serious.
Yeah.
Well, I was gonna say because I'm okay. So I actually was contemplating Botox, not because of wrinkle lines as such, but because I sweat a lot.
I was
It's
gonna
not
say
Armpit.
underarms.
No,
Yeah,
girl, my face.
No, you can't do Botox for your.
It's only underarms that if they sweat, that you
Because I literally think to myself every time, how am I going to get married? In fact, I always, every time, no, 'cause I'm thinking that I'm just going to be pouring with sweat. But
No,
even
you
aside from
won't.
that, I always look at Beyonce and I'm like, how is she doing?
I'm finished.
And then she's not sweating. There's no
I'm sure
drip
it's
on
good.
her.
But the thing is, they
anywhere.
are actually sweating.
Makeup.
You
Oh,
think
yeah,
it's
yeah, they
makeup?
are sweating, 100%. They
No,
are
I'm
definitely
sure they're sweating, but why can we not see any sweat patches?
Makeup.
It's a good
It
makeup.
can't just be makeup.
It is.
No, I
What,
reckon it
Industry
is.
brand makeup is different.
100%.
Wait, so when she did her, what was that one that was on YouTube, on Netflix that everyone was watching?
Oh my god, I know what you're talking about. I didn't watch it. I'm not a Beyonce fan, so I didn't actually watch it.
Nah,
I know
just
you're
love
talking
her
about
work
the
ethic.
Yeah, her work ethic
The
is
documentary.
documentary,
Oh,
but
yeah.
like she did back to back
Homecoming.
Yes.
Homecoming.
That's
That's
it.
it. Imagine. So that's her. Yeah, Homecoming.
Mm-hmm.
So, but she was so. I mean, she was hitting that stage, hitting everything on beat, and just like this, and wearing barely anything, but there was no sweat patches, and I was just like, how?
But the thing is, when you're barely wearing
But it's
anything, the
also-
sweat patches aren't going to show, number one, on your body wise.
Yeah.
And then secondly, that the makeup that she's using it's going to be very different to the day-to-day makeup that we're using.
Honestly, do you think she's going to be using MAC? It's not
It's not going to work.
It's not going to be MAC.
But that's a really good point.
I'm just like, it doesn't even make sense. So, okay, so going back to the original point. So if I have sweat on my face, there's no way of me covering it.
You can't. So the only
What's
places
makeup?
that
I'm screwed.
Underarms.
the only place, yeah, it's underarms.
Really?
Yeah, for hyperhidrosis.
And does that actually really work?
Yeah.
And for how
yeah,
long?
Yeah. So that one has a longer effectiveness. So typically 6 months to a year.
Oh, really?
Yeah, and then you only
Okay.
need a little top up. So I did my friend last year, and she said that she's going to come back maybe in summer.
You still need to,
Okay.
for the ones asking,
So-
it's not me, but for the ones asking, do you still need to wear deodorant then?
So it's up to you. So obviously deodorant is for smell, isn't it?
However,
but so deodorant is for smell, antiperspirant is for sweat. So I guess you don't need to wear antiperspirant, but
Okay.
you can wear deodorant for.
Okay.
That's
okay,
interesting.
Interesting.
Can't you just drink chlorophyll?
Ah.
No, again, I'm going to bring it back to the holistic part of it. But can't you just drink chlorophyll? Because apparently, if you eat enough and to be honest, I genuinely think this is partly true.
Okay.
But if you do eat enough greens and if you eat really well, you don't smell as much.
Apart from asparagus. Anyway,
That is big
continue.
facts. That is big facts. That is so true. Minus asparagus, guys, because I don't even eat asparagus purely because of that, though.
Yeah.
But yeah, what do you think about that?
I think it depends. I feel like you can say that okay, you eat cleaner and then naturally you're not gonna smell as much. But then what if you do eat cleaner and you still do?
Then use deodorant.
Exactly, that's the thing. That's the thing. So you can't
Yeah.
necessarily say because you eat clean and you're not gonna smell.
I
You
feel
might
like
actually still do.
yeah, that's true. Yeah, I still do think though, if you do eat better,
Yeah, I
probably-
think so.
Yeah,
Yeah,
your
Yeah.
pH balance altogether
Mhm.
would all just
Yeah.
automatically be better, but you might still smell.
Yeah.
To be honest, it's true though, because you might still smell even to you.
yeah.
Yeah.
So yeah,
And obviously, smell is subjective as well. So
That's very
what
true.
Someone might think it's not smell. Other people might think.
but the thing is,
Can you smell yourself? I always wonder
yes,
this, you know.
you-
'cause
I genuinely think that you can.
I think you can.
I think you can, and I think if you say that you're not, it's lack of self-awareness, and that in
No,
itself
but
is interesting as a
let's
point.
be honest, because there'll be some people that get on a train and it's like, you know, you're clearly smelling, but you've used your arm to go and collect.
But you know
collect the
what?
highest
But you know
bar.
what? I've actually realised. I feel like it depends, like from culture to culture. One might be culturally acceptable to one culture, might not be for another.
Yeah.
Yeah.
Yeah. That's
Do you know what I mean? So, like for instance, we are exposed to like stew and all these things, and like we're very hyper aware of like if our clothes smell like stew.
I'm
Yeah.
very happy away from my.
But
clothes.
some
Local
people
beans.
might not think.
Do you remember
it's not-
Iru? Is that Iru?
Yeah,
Yeah.
Whoa.
I remember you.
Whoa. I was talking to my mum about this because I went to go buy a root the other day. Sorry.
You told me
My
about
thing is
this.
panla, like
No, but that's rude. That's rude. I'm so sorry, but I'm
when
just
you got to
not.
Nigeria, your mum's like, "Can you pack padla for me?" And I'm like,
No, absolutely no
Not-
way.
not me.
No.
"But
your stuff will be smelling for weeks.
Weeks. And the thing,
No,
even when
you
you
can't
wash it,
remove
you
it.
can't remove
No,
the
it's
smell.
not worth it.
I'm sorry, absolutely not. Absolutely not. I cannot.
no, that is rude." My mum was like to me in Nigeria when people want to like insult people and you know they're fighting or whatever, they used to be like, "Your mouth smells like Iru."
I'm so
I was
finished.
in tears. That
I'm
was
not
so
surprised
funny.
though, because it's actually a good insult. To be fair, yes.
But the food is banging. I feel like
No,
it
our food
adds
is delicious.
different flavour, texture.
It,
It does.
sadly, because I was like, this smells. Well, after I ate my food, I was like, "Oh, this."
Yeah, especially in Imashi. Oh my gosh.
Oh,
Yeah.
Oh my god, you know what? Now
different,
I'm
yeah.
feeling hungry. Okay. Anyways,
going back.
Botox and fillers, because we're just talking about food now. I'm trying to think. Are there any other questions we got asked? Will I look older if I decide not to continue my Botox or filler appointments?
No, I don't think you will.
Okay.
I think obviously the effects of Botox will wear off.
Mm-hmm.
And you'll just go back to what you were looking like before. But I think it's subjective. Obviously, it really depends. Culturally, or
Yeah.
even in society, people feel like their parents of wrinkles makes you look older.
Yeah.
So if your wrinkles are returning, then obviously you might feel like you look older.
Yeah.
So
But
I
this is the
guess
thing.
in that regard, you might say, yeah, you might do.
Do you
But
feel?
this is the thing about using Botox and getting fillers and using too many filters
Yeah.
because you're actually comparing yourself to something that doesn't exist or
Yeah. You're trying to achieve a look that is
yeah.
not real.
I mean, with Botox and fillers, actually, it does exist, but I mean, with filters, it doesn't exist almost.
no.
Yeah.
So yeah.
To be fair.
Mm-hmm.
Yeah.
It's interesting.
Yeah.
I feel like, I mean, the reality of it is you just need to learn to be accepting of who you are, learn to
Yeah.
love yourself. And I think as well, what I've noticed is people who have done fillers and Botox, and there's nothing against it, like I'm not against it at all.
Oh no.
If you're somebody that's a bit overweight, you think to get fillers, you think to get Botox to kind of give a slimmer like appearance in the face. When actually, when you do lose weight, you do notice that your face, some people's faces do reduce.
Slim, yeah.
So there's also that. But aside from that, is there ways, because I've started to see this appear on Instagram, where you can apparently massage the fat out of your face? Is that a thing?
Is that the gua sha thing? Like the gua sha with the oils?
Yeah.
Yeah, I've seen that a
like
lot.
just massaging your face to like kind of like disperse the fats and stuff like that to give a slimmer.
Is that fat
illusion.
or getting rid of like excess drainage?
I think it's the drainage.
Drainage,
Oh, really?
yeah,
Okay,
yeah.
I
fine,
think it's the
yeah.
drainage. I
Is
don't
that
think you
thing?
can massage fat, but I think that's the same with like what people are doing like after like BBL care and stuff. So with getting the lymphatic drainage, it's obviously to reduce swelling, and you naturally retain water everywhere in your body. So I guess some people do see the benefits of doing it, but I don't know too much about it, so I can't really
Okay,
necessarily.
fine. No, that's fine. Yeah.
Yeah.
What are the most common, or what are your most common Botox / filler treatments?
Oh, so I get a lot of Botox, like forehead Botox.
I get that. I can understand that.
Yeah.
why
Yeah,
that,
frown lines,
Mhm.
crow's feet, so around the eyes.
Okay. What's
I get
frown
a
lines?
lot.
These ones.
No, frown lines here.
Oh, okay.
So like they get the like 11 lines. So when people frown a lot, they get 11 lines.
Okay.
And then forehead is like the horizontal lines that
Okay.
people get on the forehead. And then with filler, I get a lot actually. I get lips, cheeks.
Okay.
Those are the main two.
Cheeks.
Yeah,
Ow.
and then nasal labial folds, which is like the smile lines.
Yeah. I mean, I always. I'm definitely gonna have those. Yeah.
And then
Like-
the marionettes, like the ones that come down here from the mouth.
What is
I've never
your
heard of
kind
that
of
one
most
before.
common age group? I mean, it's probably hard if you
It's
don't know
hard.
like everyone's age, but what would you say, like maybe like a range?
So I would say from like 30 to
Mm.
about 65, 70.
Wow. I reckon that's
Yeah.
because again, as you get older, you're like you start to
Naturally
notice these
start.
things a little bit more.
Yeah.
So it's like, oh wait, because in your head you're still 22.
Yeah,
But really you're like 40 and you're like, wait, I'm still 22.
Yeah,
so but why do I?
yeah.
Yeah,
Yeah.
I can see how that can happen.
Yeah, so it's actually quite a large age range, but I like it though.
No, it's good because you get to meet
Yeah.
different people and talk to
Yeah,
different people and
exactly.
yeah.
And everyone has different expectations as well. So the younger people, they I feel like they want to change their facial contours a little bit more. Whereas the elderly ladies or my elderly clients, they prefer to not elderly. Let me say older clients.
Okay, yeah.
They would prefer to just have a fresher look. They don't want to have like a drastic change, but they just want to change their appearance a little bit or enhance a little bit.
So they're trying to stay cute for their man.
Yeah, girl.
Trying to stay cute. I
To
get
be
it.
fair, I've had couples coming together.
Really?
Yeah.
How interesting. As in that
That's
they
cute.
both get Botox or filler, or they?
Yeah.
Oh,
and it's
okay.
really
That is
cute. They
cute.
come and support. Oh, yeah, that looks really good. Oh, yeah, a little bit more. Yeah, it's really nice.
Really?
Yeah, be supportive. Like, if you both want to look good for each other. why
I love
not?
that.
like
I love
Stay
that.
fresh for your man or wife. Like,
Yeah.
it's
So
cute.
don't get complacent, guys. Look after yourself. Okay. So I want to move on to vitamin drips because I feel like you do that too.
Yeah.
So basically, I follow her on Instagram. So, but yeah, how do you know when you're deficient in a certain vitamin?
So the only actual way for you to know is by getting a blood test. There's
Okay.
no other way of actually knowing whether or not you're deficient. And obviously this whole vitamin thing has like really taken off on Instagram and social
Yeah,
media and stuff like that.
Laurie Harvey.
Yeah, and it is also controversial as well.
I was gonna say because I've got loads of
Yeah.
questions about. I'm like, how do you know you're deficient in vitamins?
Yeah.
Secondly, my thing is the person that's given it to you? Are they medically certified?
No.
That's my other question because again, you're going to somebody. It's like me just coming to uni and being like, can you just give me a vitamin
Oh,
drip?
Okay.
Maybe vitamin
there with
B.
vitamin F.
That's what I'm saying. And how do we know what is what and who's
Yeah.
giving you what?
Yeah. So with vitamin and nutrition, you don't really know if you're deficient unless you get a blood test.
Okay.
But the good thing is that normally, if you don't need it, you excrete it anyways in your urine.
Okay.
And typically, I think, well, for me, the only clients that I've seen that have actually come in are those who actually know they're deficient already.
Okay.
So I get a lot of people who come in for like vitamin B12, and they already know that they're anemic, and they already know that they're vitamin B12 deficient. And so they come in because they're already aware and they know. And we do tell them, like, if you're not, then you'll just excrete it in your urine. And if you are deficient, then obviously you'll have the benefits, as in you'll be less tired, less lethargic, and stuff like that.
I feel like I see a lot of stuff around vitamin B12, even in
Yeah.
just the fitness type industry.
Yeah.
In saying, oh, you know, if you're going to go out and drink, for example, make sure you pop like a bit vitamin B. Is that even a thing?
I don't even know why. I don't even know.
I don't even know why that's a thing. I see it all the time though.
Yeah.
I actually haven't seen it, but maybe because I don't really follow fitness pages that much. But like vitamin B12 is important for like just your development of hemoglobin. And so if you're deficient, normally you'll be a little bit anemic and you're a little bit tired and lethargic. So maybe that's the added benefit, that you'll be less lethargic. But if you're not deficient, then it's not really, it's not necessary.
I was gonna say, with what is the difference between having it as a drip and having it as a
chewable or a
like
pill?
a chewable or pill?
It's the bioavailability.
Okay.
So with
Please, in English.
so basically, if you have something that goes into your vein, it goes straight into your system. Whereas if you're chewing something, it has to go through your GI tract, so it's broken down, and not everything goes into the system because it has to be metabolized.
Okay.
And so it's just how available something is. So say for instance, you are going to the hospital and you are unwell and you're getting antibiotics. If you want it, the effects to happen quicker, we'll give it to you through the vein. And then once you're a little bit better, then we'll switch you to oral antibiotics. So it's just the availability.
Okay. And does it last longer if you do it through the drip via?
I don't think it necessarily lasts longer. I think
it's just more about how quick
Yeah.
it gets to the
Almost,
yeah.
Fine.
So I mainly do B12 injections as opposed to the drip, because, as I said, like my clients know that they're deficient already, and so we just load them, and then they come back every 3 months because they're deficient. They know when they need a top up because they get very tired, very lethargic. They have the symptoms, and then
Are there other vitamin drips that you can have that are not vitamin B? So, for example, somebody mentioned to me that they do it when they're feeling really hungover. For example, they go for a vitamin drip.
Yeah.
Is there a benefit to that? And also, if it's not B12, what other drips are there that are available?
So some people have drips that have other vitamins in them. So some people have like vitamin C and like just the normal nutrients that you will get, so like magnesium, potassium, those things. But I don't think there's actually any added benefit of having a drip after being hungover.
Guys, did you hear that?
But it doesn't mean that some people might not feel better after having it. And obviously after your hungover, you want to have like a good hearty meal. You feel very lethargic, and sometimes that helps with just giving nutrients overall in general after being very hungover. But I don't know if there is. Someone please correct me if I'm wrong. I don't know if there is actually an added benefit of having like a vitamin B12 or any other drip after being hungover. Yeah. Is it something that you guys have considered?
Vitamin drips, yes. Doing it after I'm hungover, no. I just feel like if I'm hungover, I hardly get hangovers, to be fair. But if I am hungover, I know it's my fault.
Yeah.
And I know my body's saying to me, next time, behave yourself.
Yeah.
Do you see what I mean? So I'm not like, let me go get a vitamin drip. But I'm one of those people I like to research things before I actually do it. Sometimes it takes me a while to come around to vitamin drips, Botox, things like that. So yeah, I would definitely consider it. But it wouldn't be because I'm hungover. It would be because I'm deficient in this vitamin. I know I'm deficient in this vitamin. Let me go and make my body better.
Yeah.
That would be my answer to that.
Yeah.
Nate, what about you?
You know what? Quite similar. I think it's just knowing that you're deficient in something and knowing, okay, fine. If I'm not noticing a difference through taking it via a pill or by chewing it, then I would think to just do it via a drip. If that
Yeah.
is a faster way of getting it into my system.
Yeah, that's fair.
I'm just pulling up if there's any more questions from Insta that we had. Increasing social media we've spoken about. Oh, I like this question. Should people implement vitamin drips as part of their routine? The same way we do nails, hair maintenance.
I don't think you need to. I think if you just overall, if you eat well, you can naturally get it in your diet anyways. Obviously, like eating 5 a day, vegetables, having an active life.
Yeah.
I don't necessarily feel like you need to, but I feel like the society today is actually moving in a direction where they want to get everything quickly.
Yeah. Oh,
Microwave society,
Yeah,
guys.
like they want to get everything
100%.
quickly,
Yeah.
and I feel like this is kind of a part of it. I don't see what the added benefit of having a vitamin drip or a drip in general every day, like you do when you get your nails and everything done. Yeah, I don't see the appeal.
I mean, that's good because it saves people some money.
Yeah.
It saves you money, but also again, it's that it takes away from what's the thing when you wait for things, immediate gratification. That's what I'm looking for. I feel like these things sometimes are just immediate gratification, and sometimes you just need to work for things, and that's just it is what it is.
100%.
Eating your 5 a day may be better for you. Having the vitamin drip if you're deficient makes sense, but if you're not deficient, then really there's no point.
Yeah.
That's the thing. I think like we definitely live in like a microwave society where everything, like you say, everyone wants everything quick. Everyone wants everything now. They don't want to kind of wait for things to stew and to kind of build up. I'm talking about food. But the idea is that like everyone wants everything immediately.
Yeah.
And I think also when you see things on social media, you have so much access to celebrities and what they're doing. And so when they say, "Oh, we're doing vitamin drips," for example, it's like, "Oh, we've got to do it. We've got to be like them."
I've actually got a question regarding that. Do you follow celebrities on Instagram? Because I actually don't.
I don't either.
Yeah.
I don't.
I do. But I
Which
don't.
ones? Because I feel like yours will be very particular.
Do you know what? Funny enough, I think this will shock a lot of people.
Okay.
I do follow, what's her name? Kelly Rowland.
She's cute.
But I also follow Kim Kardashian. Now wait,
Interesting.
because I've had my moments.
What's wrong with that?
No. Do you know what it is? Because I feel like there's a lot of misconception around her. And I feel like a lot of people don't rate her because of the way she came about to her celebrity status. But the things I take away from her is her work ethic.
Yeah, we've spoken about this as well previously on another episode. Yeah.
Yeah. So like I look at her work ethic, and that to me is what is like inspiring. And the fact that she's now a mother, and I know this will be controversial to a lot of people because a lot of people will say things like, "Yeah, but she's got nanny, she's got access to all these funds and stuff like that." And yes, I don't disagree with that, but nevertheless, her kids know who she is. Her kids don't not know her. And her work ethic is second to none. She's got so many things happening, and she still stays relevant.
Yeah.
So there's something about what she's doing that's working. That that sometimes I'm just like, oh, let me just see what takeaways I could take from her.
Yeah.
Do I follow her religiously to say like if she does something, I'm gonna do it? Absolutely not.
Yeah.
If she turns around and says that she went to go and do butt injections, I'm not gonna go do that. I mean, I don't need it anyway, but I'm not gonna go do that. But my whole point is that there's from her work ethic, that's some of the things that I'm trying to pick at when I see what she's doing.
I think there's takeaways from everybody. Do you know what I mean? Celebrities, non-celebs, people that you meet day to day, people that you meet on the tube, just something, someone can teach you anything.
Yeah.
So I completely agree with that from that perspective. And in the context of what we're talking about, do you think a woman's looks really has something to do with her success in her career and where she kind of is?
Yes.
Unfortunately, I think so.
100%.
Love to hear it because you know what? I thought one of you was going to say, and I was going to say lies.
Do you know what? There was a post that went out recently about what's her name? I don't know how to pronounce it. It's SZN.
Scissor.
Scissor. Is it
Yeah.
Scissor?
Yeah, scissor.
Essedén.
The only reason why I feel like I know that.
Essedé, no?
Is
Wait,
it
is it not?
Oh,
Essedé, not Essedén.
is it?
I knew who you were talking about. So I don't know why. I knew who you were talking
Scissor?
about. Though.
But is that
one of
what
my
they call
friends
her?
is
Yeah,
obsessed with her. So
Scissor.
If
yeah.
they call her Scissor, yeah. So
Scissor.
Scissor. But there was a post that came up about her, and it was kind of like trending, and it was something. There was two side by side pictures. There was one where she didn't really have money and one where she did have money.
Yeah.
And the comment was like, it's good to have money or something. Or this is,
Yeah.
you know, there was a comment to the fact that when you make money, you can see the difference in appearance, in the way someone looks. And so, yeah, in answer to your question, yeah, I do feel like there's a difference.
So you guys are saying that pretty privilege is a thing?
I think so, you know.
Well, on that note, I think that's a topic for another day. So do you know what? Let's wrap this up. Let's cheers. And at some point we're going to talk about pretty privilege.
Absolutely. Stay tuned for that.
All right.
Dr. Deborah,
Yeah.
thank you very much for answering all our questions on Botox,
Thank you
fillers.
very much.
I feel like something else we got. Vitamin drips.
Yes.
There we go. Guys, again, if you have any other questions that we may have missed, please ask them. Please comment them.
Yeah, definitely. And just to go off with that as well, I think if there's any questions you may have, let us know, slide in our DMs, and we will definitely or Deborah's and we can try to get back to you with some further information. But if there is anything that you're unsure about, if you need like further medical advice, then seek further medical advice. It's a wine, guys. It's a wine.
Seek further counsel, she says. And on that note, guys, cheers.
Cheers.